am Mrs. Rajakumari, Assistant Professor, Department of Biochemistry, V.V. Vanniya Perumal College for Women, Virudhunagar. Today we are going to see about transplantation immunology. First we see about introduction. So, transplantation is nothing but transfer of tissues or organs from one individuals to another individuals. Okay. So, in case of failure of organ or tissue, that is, it can be replaced by the healthy organ or tissue by donated by the donor. Okay. Transplantation is a life savior process. Okay. It is employed whenever the treatment options fail. Right. So, the immune system is one of the play a significant role during the transplantation mechanism. So, the successful transplantation is all dependent on the complex mechanism of the innate immunity. Next we see about the history of transplantation. So, there are lot of scientists, they got the Nobel Prize for successful transplantation process. So, under this category, the scientists Peter Medawar and scientist Alexis Carrel and scientist Bruce Gates and the another one scientist Odud Rizim. So, there are the four type of scientists. They got the Nobel Prize for cornea transplantation, heart transplantation and blood vessel transplantation, etc. So, the successful transplantation was carried out in the year that is 1905, 1912 and there is Sir Peter Medawar. So, he is the father of transplantation. What is graft and what is grafting? Okay, graft is nothing but the transplanting organ is nothing but graft. Grafting is nothing but it refers to a surgical procedure to move tissue from one side to another on the body. Okay. So, next we see about types of graft. There are four types of graft. One is autograft, the another one is allograft, the third one is isograft, the fourth one is xenograft. Autograft is nothing but transfer of tissues or organ between the same individual. Example, skin graft. The another one is the allograft. Allograft is nothing but transfer of tissues or organs between same individual of the different species. Example, kidney transplantation, liver transplantation, bone marrow transplantation, then spleen transplantation, etc. The other one is the isograft. Here, the tissue or organ transferred between identical twins. Right? So, example, twins. Between the twins, the organs or tissues transferred from one another. The last one is xenograft. So, here transfer of tissues or organ from one species to another species. Entirely the species differ. Right? Example, monkey from human, monkey to pig, etc. Autograft, isograft, xenograft and allograft. So, this is allograft. So, this diagram represents the mechanism of the different types of transplantation. Right. So, autografts is nothing but the transfer between same individual. Under the skin graft, transfer between identical twins, and under the allograft, transfer between non-identical individuals, and xenografts, the transfer carried out between different species. So, this picture represents the autograft acceptance and allograft rejection mechanism. Autograft acceptance occurred in within 7 days to 14 days. Right? The best example for autograft acceptance is skin graft. Okay. So, under the skin graft, that is day 3 to 7, that is revascularization process is carried out, and after the 7th day, healing process is carried out, and after the 12 to 14 days, the resolution of the skin is carried out. So, normal skin is accepted after 14 days. Right? Next, we see about allograft rejection mechanism. So, under this mechanism, there are two types of allograft rejection mechanism is carried out in human being. One is first set rejection mechanism, the another one is the second set rejection mechanism. Under the first set rejection mechanism, within the 3 to 7 days, the revascularization process is carried out. After the 7th day, cellular infiltration process mechanism is carried out in human being, and within the 10 to 14 days, thrombosis and necrosis will occur. So, after thrombosis and necrosis, that is the graft will rejected. Right? It may be kidney graft, or it may be liver graft, or it may be bone marrow graft, or it may be spleen graft, etc. Right? So next we see about second set rejection mechanism. Under this rejection mechanism, that is 3 to 14 days, within 3 to 14 days, cellular infiltration is carried out, and after the that is 5 to 6 days or within the 1 week, thrombosis and necrosis will occur. So within the 1 week, that is the cell will undergoes the decline phase, that is the tissue graft, or it may be liver or it may be kidney or bone marrow, it goes to the decline stage. So the graft will rejected after 1 week. So next we see about types of rejection, that is what is the type of rejection means, that is there are 3 types of rejection. One is hyperacute rejection, the second one is the acute rejection, the third one is the chronic rejection. Under the hyperacute rejection, here due to the presence of the pre-existing antibodies or due to the presence of the memory cells, the match the foreign antigens of the donor and recurs the immune response, the rejection is carried out. Okay, so this rejection takes place within the minute or after the transplantation. So the physician will give immunosuppressive, some amount of or some dose of immunosuppressive drugs before transplantation and after transplantation. So yeah, whatever it is, so after transplantation, in the case of the hyperacute rejection, the rejection will carried out within hours during the hyperacute rejections. So here, after the rejection mechanism, that is the blood clotting takes place when antibodies react with the cells in the blood vessels of the graft. Okay. Next, the another one rejection is acute rejection. So this rejection, there is no high risk of first month of recipient. So here this rejection takes place within first 6 months after transplantation. So after giving the immunosuppressive drug, say for example corticosteroid drug or calcineurin drug, tacrolimus or sirolimus, whatever it is, so within the first month the rejection will carried out. Okay, due to the lot of reasons, say for example the individual patient's body mechanism, the next main reason is that is the dosage of the immunosuppressive drugs, etc. Right? So there is a high risk for the first 3 months for recipient, and however rejection can still takes place at the later stage. Okay, so by suppressing the immune system, acute rejection can be treated somewhat with the help of immunosuppressive drug. The another one rejection type is chronic rejection. So this is a silent killer rejection mechanism. So in this type, that is recurrence of the particular graft occurring, that is years to years, that is within 1 year, after year or few years, whatever it is. The recurrence of acute rejection can definitely leads to chronic rejection of the graft, resulting in the failure of the kidney, that is bone marrow, heart, etc. Right? This exhibition of chronic rejections occurs in 1 to 5 years also. Right? There is no cure for chronic rejection, that is except for removal of the graft till date. So far we have seen about what is graft, what is grafting, what are all the types of graft and what are the types of rejection carried out in human being. Right, students? So next class we will see about what are all the detailed mechanism behind it. Okay? Thank you students.